accepting, supporting, and caring for people affected and infected by HIV and AIDS. There was a rather interesting television presentation that my wife was telling me about, where a fellow who I remember what disease he had, but he was unable to function well physically, and yet he made up his mind that he was going to join the track team, and he began running. And in one session he was out there running, and he just lost steam after a while, and he didn't have that sense of rhythm, and he was having a struggle. His coach came up and started walking with him, and walked around the track with him, and then his classmates began joining him, and they also walked around the track with him. Something like that needs to take place with those young people in school who are facing incredibly difficult situations at home. Could be by AIDS, and of course, as a consequence of AIDS, and there could be other factors. But the school needs to rally together. The classmates need to rally around these people, and it does happen. But it can much more readily happen by plan than by accident. And there are some evidence, some very good examples of this having taken place. Negative effects of HIV and AIDS on learners, we could list several of those. I better not take time for that now. Accepting and supporting and caring critical questions for examination and action. What children in your community are impacted by the AIDS pandemic? Addressing the community, what problems are they facing? How are these problems affecting their ability to attend school? And how is it affecting their performance? In what ways can the community help these children? In what ways can the school help? Are there school teachers and other staff members who are infected or come from AIDS-infected families? How can the school and community assist families, these families perhaps affected by HIV and AIDS? I can give you, if you're interested, a report a very encouraging report, kind of a case study that was written by Lorraine Lawrence, of a school principal in a very impoverished area in South Africa, who over the course of many months was able to mobilize her school and her community to join together as partners to address the AIDS issue in some very innovative ways. I think we need these kinds of examples to kind of give us an idea of what is possible, what can take place. The big prize is a step forward to promote values and behaviors that preserve and protect the health and welfare of children and their school and their community. I do have a workshop also that I can make available to you if you're interested, that can facilitate this process. Thank you.
Good morning. Hi. Well, let's take a significant turn now from Dick's content of the presentation, which was looking at values transformation, specifically in developing countries in Africa. And my topic is a little bit different. We're talking about transforming U.S. church values in orphan care engagement. So my background is I'm with the Faith to Action Initiative, and has anybody heard of the Faith to Action Initiative before today? Okay, just a few. We're a group of organizations, and you might see on my bio, I work for Food for the Hungry, and Food for the Hungry is a member organization of Faith to Action. It's a group of organizations that have come together to say that there are some best practices in caring for children, specifically orphans and vulnerable children, and those best practices usually involve family and community-based approaches. And we've recognized that there's this growing orphan care movement in the United States, and sometimes the best intentions don't actually lay the best plans. So we advocate to U.S. Christian churches and faith-based organizations that are seeking to address those needs of orphans and vulnerable children, both in sub-Saharan Africa and beyond. So why is this needed? You may have read the book When Helping Hurts, and if you did, you saw that there's about $1.6 billion per year spent on short-term missions just by Americans. So this is a movement. This is a big business even. $1.6 billion, and that's about 2.2 million individuals who are going on these short-term mission trips. The average time is usually a couple of weeks, and most of those short-term missionaries are going to vulnerable communities. So many of them are going to work with orphan care type of projects. And orphan care is a top growth area for Christian giving. The Evangelical Council for Financial Accountability every year puts out a list of the different areas of giving in Christian circles, whether it be churches or individuals. And last year, for 2011, of the top 4 areas of growth in giving, 3 of those were related to orphan care, whether that was global orphan care, adoption, or child sponsorship, which has some implications for orphan care as well. So we see a huge heart developing. We see a lot more funding going toward orphan care, but are churches practicing the best practices? So I'd love to ask you, just for a moment, to set aside your professional role, all the great education that you may have had in development and international development, and take for a moment and just try to imagine yourself as the typical American churchgoer. Now, I know a lot of us here are not from the U.S. and maybe have not lived in the U.S., so that might be difficult for some of you. But from your best estimation and your interaction with the typical American churchgoer, if I were to ask, where do orphans live? Or if I were to say, if we wanted to fund a place that would be a great place for orphans to live, what would be the word that the typical American churchgoer would think? Okay, so regionally they might think Africa, they might think South America, and as far as a place where orphans would live, what kind of facility would they live in? What would you call it? Orphanage, right? I mean, the word is even in, the word orphan is even part of orphanage. And so we find that many wonderful-hearted people, when they're interested in caring for orphans in developing countries, specifically in sub-Saharan Africa, they're thinking that the best way to do that is to fund an orphanage. So we'll talk about that assumption in a couple of minutes. Okay, another question. Again, pretend that you didn't hear Dick speak just now and you don't know much about orphan care. You're just the typical churchgoer. How many living parents does an orphan have? None. In fact, most people just assume that the definition of an orphan is a child with no living parents. We'll talk about that assumption as well. And then third, who does God use to help orphans? This is a question that when we go and share with churches and when Christian movements become interested in orphan care, there is something beautiful that happens when someone realizes, I can make a difference in the life of an orphan. That's something wonderful. And so many American Christians, once they're awakened to the needs for orphan care, they would say, God wants to use me to help orphans. So these 3 questions, where do orphans live, how many living parents does an orphan have, and who does God use to help orphans? The answers that we just gave are true some of the time for orphans around the world, but most of the time, they're not true. So let me explain some of the answers, the values transformation that we try to bring about in local U.S. churches as they're seeking to do orphan care well. I'm going to gloss over much of this, and much of my presentation is to convince you that you want to pick up this publication and this publication. These are both here available, complimentary to you here on the platform. We charge for them online, but they're also available as PDFs, and they're free here at the conference. These are both publications of the Faith to Action Initiative. The blue one is our initial publication that talks about what the best practices are, and the brown one, Journeys of Faith, is a resource guide that gives case studies of different organizations that are doing this. So where do orphans live? Well, when we start talking with U.S. churches about the assumption that orphans would live in orphanages, we first point out orphanages are very expensive. The average cost of raising a child in an orphanage, or we would say institutional care or residential care or a children's home, those terms are usually interchangeable among churches. The average cost is about 6 times as expensive to raise a child in an institutional setting than to make sure a child is raised well in a family setting or community-based care. Orphanages can only reach small numbers. So if a church is not convinced at that point that building a long-term institution is not the right thing, we can start talking about how many children will that children's home house? Will it house 10 children, 50, 200? And then we'll talk about that probably is not going to meet the needs of all the children in the area. But what if there were a more cost-effective way where you could make sure that the needs of every orphan or vulnerable child were met? And then finally, orphanages, we've seen from study after study, fail to meet children's long-term needs. Sometimes institutional care is necessary for a time, but over the long term, here's what we see. Children raised in institutional settings experience more physical delays. Now, that's a surprise to a lot of people who assume that if we gather all these kids together, we can make sure that they're physically taken care of. You know, when we think about orphans living out in the community, we think about street children, and we think about how they might not have shelter, they might not have food to eat. And yet, we see that children raised long-term in orphanages, compared to orphans raised in the community setting with extended family, experience more physical delays. That would be metrics like height, weight, head circumference. It would also be delays in development, sometimes failure to thrive. We see mental delays with children who are raised in orphanages as well. And then finally, social delays. If you have done any kind of work with orphans or foster care, you've learned the word attachment. Attachment is something that we're learning more and more about these days, understanding that the connection that a child has to a parent, specifically to a mother figure, is irreplaceable. It's one of the most important things, or I would say even it's the most important thing for a child growing up. And if they don't have a connection to a mother who is there for them 24 hours a day, connected to them throughout their childhood, then children experience attachment issues throughout their lives. So ultimately that can lead to social problems, to violence and issues as they grow older, but it can also lead to issues in marriage, issues in raising their own children, the inability to attach to anybody. And then socially, I would also just make the point to a church considering this that we think of orphans as having lost everything, but even if a child has lost both parents, which is incredibly significant, it's the worst thing a child can go through, even if that has happened in that child's life, they still have something. They have their local community, they may have extended family, they have their neighborhood, their local church, their school. And do we really want to take a child out of all those things that they have left and place them into an institutional setting where we have to create those things anew for them? So the value that we would talk about with churches is that children grow best in families. And Psalm 68, verse 6 is a great example of that. God sets the lonely in families. We don't see orphanages in Scripture. We don't see children's homes. We see children growing up in families. Okay, the second question, how many living parents does an orphan have? Some of you may be already familiar with these statistics. There are 153 million orphans globally. That's an estimation. But when we break down those numbers, here's what we see. The yellow part is the most significant, which is 100 million children who have lost a father. The gray area is 35 million children who have lost a mother. And only 18 million of those children have lost both mother and father. I don't mean to say only 18 million as if that's a small number. We grieve whenever a child loses both parents. But what that means for orphan care is that we need to be aware that when we talk about the number of orphans in the world and the children who really need an intervention, we really need to be talking about all of these children. And because of that, the intervention is not going to be institutional care most of the time for children who have a living parent. So the value here is family preservation. And these photos that I'm using in the presentation are all from Ethiopia. Food for the Hungry works with orphans and vulnerable children in Ethiopia. I had a chance to go visit last year, so I wanted to show off some of the great people we work with. James 1:27 has become the clarion call of the orphan care movement among Christians. And it says, religion that God our Father accepts as pure and faultless is this, to look after orphans and widows in their distress and to keep oneself from being polluted by the world.